Welcome to Live Chat. I'm Sean.
And I'm Kim.
Where we provide you with limitless
pieces
of inspiration. What are we going to talk about today? Assessments. It is Mental Health Month. What are some of our hashtags for Mental Health Month? Hashtag 31 Days of Wellness and hashtag 31 Tools to Thrive. I did the two because it's a number sign. Kim, get us started with the conversation about assessments.
So one of my favorite tools is
What's her favorite tool? She's going to tell us.
Free online assessment tool that was created by Mental Health America, and you can find it at screening.mhanational.org.
There it is right there.
And what's great about this tool is so many people reach out and say, where do I turn? I have a son or a daughter or a mother who's struggling, and where do I turn? And so I always first refer them to the online screening tool. Number one, it's free. Number two, it's completely confidential. And number three, you can actually take a variety of different assessments, whether you believe you might be suffering from an eating disorder or bipolar disorder. Post-traumatic stress. And so it really gives you an opportunity to really kind of dive a little deeper to find out, are you suffering from some of these mental health conditions? And then from there, it helps to connect you to resources to find support.
And there's so many tools and there's so much available on the assessment. You can do them from, if you have a teenager that loves their smart device, they can use it from an electronic smart device. Also, there's an assessment for where we spend the most amount of time, a work assessment.
Yeah, that's new.
That's new.
And what's great about that is that it really kind of takes a look at is, how is your workplace dealing with mental health?
Correct.
How
are you dealing with mental health within your workplace?
Right.
That's a whole nother topic. But with that, so Kim, let's just talk about the fact that these assessments are available because why? Recovery is possible. We are living proof that recovery, when you learn how to tap into your mental health and you identify where you need to improve your mental health, that recovery is possible. Kim, spend a minute or so on that.
So many people get stuck and they go down a rabbit hole and they figure, I can't get beyond this, or they're thinking that they're a victim. But there's so many strategies and coping mechanisms to get through it and to figure out what works for you, because we're all different. We have different brains, we have different biochemical makeup.
Mental health is not one size fits all. Mental health is a big process for us to navigate, but there are tools for no matter where we are in the mental health. If you're a beginner, if you're middle, if you had to go back to the beginning, there's so many tools that have come out since you were at the beginning. So there's so much. So this Mental Health Month, the 31 days of this month to really engage in your mental health and to keep that going forward. What we want to encourage you to do is let yourself out of that cage, that mental health cage that you feel you're locked in. Open that door, get access to the tools. 31 Days of Wellness, hashtag 31 Tools to Thrive. That is,
and know that Mental Health Connecticut, as part of our celebration for Mental Health Month, we're raising money that's going to go towards our mental health at home programs. And so, if you can help contribute, but also know that the tools are there. Visit our website, check out, all the things that we're offering and take advantage of it.
That Kim couldn't have said it any better. So that's amazing stuff. Engage this month, give back, invest in you, invest in others. We are super happy to have this time with you today. And that's it for today.
Peace out, my friends.